Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. This is Sam Abdul, your lecturer in medical terminology. Our lecture today is about the medical terminology of the urinary system. Our objective here is to name, recognize, define, spell, pronounce terms related to the anatomy, pathology, pathogenesis, diagnostics, and management procedures of the urinary system. The urinary system structures, also referred to urinary tract, consists of two kidneys, two ureters, one urinary bladder, and a urethra. The adrenal glands, which are part of the endocrine system, are not part of the urinary system, but they are located on the top of both kidneys. This is the combining forms of the urinary system: kidney related, nephro or renal pelvis, pyelo, say pyelonephritis, urine, uro or urino, urolithiasis means stone in the urinary tract, urinalysis means examination of the urine, uretro means related to the ureter, cysto or vesico related to the urinary bladder, urethro related to the urethra. And keep in mind, urethro is totally different from uretro. Prostato or prostatic is related to the prostate. Now we will deal with each part alone. Here first we deal with the kidneys, the uppermost part of the urinary tract. The kidneys, which is related to the kidneys, is called renal. It composed of fibrous capsule, then comes the cortex, then the medulla, then the calyces. First, the cortex. The renal cortex is the outer region of the kidney. It contains over 1 million microscopic units called nephrons. Where do we find other cortices? In the adrenal, there is cortex, and it's very important. It's important anatomical structure. There is cerebral cortex. We are talking about it too much. It's important anatomical structure and many other parts. But these two are the main two examples that are important. Then come the medulla. Medulla means the inner part. It's the inner region of the kidney. It contains most of the urine collecting tubules. Then the urine formation occur, and the renal pelvis is the funnel-shaped area within each kidney that's surrounded by renal cortex and medulla. The kidneys are connected to the ureters later to convey the urine to the urine bladder to be excreted. This is the functional unit of the kidney. It's called the nephron. Nephron is the functional unit. It's composed of the glomerulus and collecting tubules. Glomerulus is a tuft of capillaries surrounded by a capsule called Bowman capsule, while the tubule is the miniature of a small tubule. The ureters are two narrow tubes, each about 10 to 12 inches. Inch is 2.5 centimeters long, which transport urine from the kidneys to the bladder. The urinary bladder is a hollow muscular organ that's a reservoir for urine before it is excreted from the body. The urethra is the tube extending from the bladder to the outside of the body. The spelling of ureter and urethra are very similar, but their position and anatomy are different. Now we will deal with the specialists who deal with the diseases of the urinary tract. The nephrologist and urologist both treat kidney problems, but the nephrologist is the medical specialty which focus on the kidney function and disorders that affect how the kidney work, like diabetes, chronic kidney disease, etc. While urologist is the surgical specialty which focus on obstructions, infections, tumors of the urinary tract, and diseases of the male reproductive organs. To simplify that, nephrologist is internist or internal medicine, while urology is surgery. Let's talk now about urinary system pathologies. The most important to deal with and to understand is the renal failure or kidney failure. When the kidney don't function at all or at a low capacity, the kidneys are unable to filter blood properly. There are two types, either it's acute renal failure or chronic renal failure. The acute renal failure, or called acute kidney injury, acronym as or summarized as AKI, acute kidney injury. Chronic renal failure, CRF, or chronic kidney disease, CKD, is the same. The acute onset, as its name indicates, is sudden, while chronic is gradual. The symptoms of renal failure include dehydration, fluid overload, hypertension, oliguria, or anuria. The treatment may include dialysis, like hemodialysis or peritoneal dialysis. The interchangeable term which are used with renal failure is uremia. There is something in the blood which is increased, which is called urea. Uremia, also known as uremic poisoning, is a toxic condition resulting from renal failure. Then, dealing with nephrotic syndrome. We are not dealing with inflammation, we are dealing with syndrome. Syndrome means constellation of symptoms, constellation of sign symptoms caused by conditions that affect the tiny glomeruli of the kidneys. Notice that glomerulus is summed as glomeruli. When there is effect on tiny glomeruli, there is excessive loss of protein throughout the urine, causing proteinuria. We are losing protein excessively in nephrotic syndrome. That's why the patient may come to us with edema and fatigue and exhaustion. Edema is the excessive fluid in the body tissue. Proteinuria, there is something which is protein excreted more in the urine, is the presence of high concentration of protein in the urine. There are different terms regarding urine and the shape of urine in the medical practice. Anuria, absence of urine. Diuresis, there is increased production of urine, whatever the cause is. Dysuria, there is painful urination. Enuresis, enuresis means involuntary urination. Glycosuria means there is glucose in urine. Hematuria means blood in urine. Oliguria and polyuria, there is decreased or excessive urine output. The enuresis and the incontinence are interchangeable to be used. Incontinence means ascelis, means the inability to control the excretion of urine and feces. There are urinary incontinence and fecal incontinence. Urinary incontinence or urinary urination happens involuntarily, affect personal hygiene and social life. It's a very embarrassing situation. Urinary retention, on the opposite, is the inability to empty the filled bladder. The condition is also more common in men. Why? Because there is association with the enlargement of the prostatic gland, whether it's benign or not benign. Dealing with the renal pathologies in more specific way, we deal with the pathology called nephropathy. Nephro means kidney, pathy means disease, diseases of the kidney. The first one is hydronephrosis. Hydro means water, nephro means kidney, osis means abnormal condition of the disease, which means it's the dilatation of one or both kidneys due to some pressure over there. Hydroureter. Hydro means water and ureter means ureter. It's the distension of the ureter with urine that cannot flow because the ureter is blocked. Now, apart from that, now we have the itis term. Itis means there is an inflammation. Glomerulonephritis. Glomerulus is a part of nephron. Nephr means kidney. Itis means there is something called inflammation. So it's inflammation of the glomeruli. There is primary or secondary cause. Primary start in the glomerular or secondary. Glomeruli are affected by systemic disease, like that what's called SLE or systemic lupus erythematosus, and the IgA nephropathy, and other diseases. Acute symptoms develop suddenly and resolve with treatment, while chronic glomerulonephritis, if acute disease not treated, disease process develops slowly and cause irreversible damage to the kidney. Now we will deal with somewhat infrequently seen disease or rare disease, which is polycystic kidney disease. Keep in mind it's totally different from polycystic ovary syndrome. Polycystic kidney disease, there are multiple kidney cysts develop as a result of a genetic illness known as polycystic kidney disease, PKD, which eventually impair the kidney function. That's why the patient may need to remove this one, and their kidney function are somewhat disturbed. Renal colic, colic, is acute pain in the kidney area. What's colic? Colic means spasmodic pain in the abdomen. Keep in mind in the previous lectures regarding gastrointestinal tract, when we dealt with colon, we said that colonic and colic are describing what's related or pertaining to colon. So keep in your mind that colic here may be understandable in its setting in the sentence. Colic means spasmodic pain in the abdomen, and in the shape at the bottom describe the sites of renal colic from the loin to the groin. The term loin to the groin pain is the origin from the loin, from the kidneys, and the radiation down to the groin and maybe up down to the testes. Then, in the medical practice, we used this term so much. We use stones, renal stones, vesical stones, ureteric stones. Sometimes we say calculi, and sometimes we say different terms including lith. Let's examine our knowledge. Nephrolith. Nephrolith. Lith means stone. Nephro means kidney, so we are dealing with the kidney stones. Nephrolithiasis is the formation of the renal stones. Ureterolith. Uretero means ureter, and lith is the stone. So it's a stone locating along the ureter. So this process itself is called ureterolithiasis. Is a stone locating along the ureter. Cystolithiasis. Cyst means urine bladder, lith means a stone. Okay, so the process is cystolithiasis. Okay, regarding the bladder itself, the bladder we call it as bladder or cysto or vesicle. The infections is frequently encountered in the medical setting, and urinary tract infection among the most frequently seen in the consultations for many patients. They can affect any part of the urinary system. If the inflammation occur in the urethra, so it's urethritis. Cystitis is the inflammation of the bladder. Pyelitis is the inflammation of the renal pelvis itself. Pyelonephritis is different from pyelitis in that it involves the pelvis and the kidney, the parenchyma of the kidney. From infection, now we are dealing with a very common problem, mainly in the old age men, which is benign prostatic hypertrophy, or also known as benign prostatic hyperplasia or enlarged prostate, where the prostate is enlarged as seen in the figure on the left. It's enlarged prostate with obstruction of the outlet of the urine bladder. So there will be many hesitancy and frequency sign symptoms. This is a benign condition. When the enlargement of the prostate or the prostate itself is taken by tumor, say it's a prostatic cancer, it is one of the most common cancers among men. If there is an inflammation of the prostate, it's called prostatitis. Prostatitis. It causes excruciating pain and stress. Now, far from the diseases, we will deal with the diagnostics and investigations. There are a very formal daily use term, either general urine examination or urinalysis. They are interchangeable in the medical practice. Urinalysis is a simple test that assesses the urine. It checks the appearance, concentration, and the content of the urine. There is macroscopic, chemical analysis, and microscopic methods. Different benefits are taken or obtained from urinalysis as initial non-invasive investigation regarding renal diseases. Another one, non-invasive, is the kidney ureter bladder X-ray film, erect abdominal X-ray film, which is called KUB for kidney, ureter, and bladder. This is also non-invasive, while the invasive one is the cystography. Let's separate these two forms. Cysto means urine bladder, and graphy means the picturing or recording. So it's the radiographic examination of the bladder after installation of a contrast. Contrast means al-صبغة, resulting film called cystogram as is in the left. There are interventions regarding urinary bladder and urinary system. The catheterization أو القسطار is the insertion of a tube into the bladder to remove urine when the patient is unable to urinate. In our medical practice, we dealt with urinary catheterization in daily practice by using Foley catheter. Cystoscopy is the visual examination of urinary bladder using a cystoscope. Cysto means urinary bladder. Scope means visual examination. So they are using visual examination to see interior parts of the urinary bladder. The intravenous pyelogram. Intravenous means through the vessels. Pyelogram. Pyelo means renal vessels, renal pelvis. A gram means picturing or recording. So, as its name indicates, it's the use of radiographic material to see the renal pelvis. The contrast medium is administered intravenously to clearly define these structures in the resulting image. And maybe it's helpful to see and to examine the picture on the left to get better information. The dialysis. Dialysis means in Arabic it's الغسل الكلوي. Is the procedure to remove waste products from the blood of a patient whose kidney no longer function, or patients with advanced renal failure. Dia means complete. Lysis means separation, which includes the separation of waste products from blood and return of the blood to the body. There are types of dialysis. One is hemodialysis, when we use or cleanse the blood from the waste product, and peritoneal dialysis, we use the peritoneal cavity to cleanse the patients from the waste products from the renal failure. Really, dialysis is a transient process or transient mechanism or a procedure to be taken for patients later on to have renal transplantation, which is the ultimate treatment for patients with renal failure. هذه نهاية محاضرتنا regarding renal function, renal anatomy, renal pathology. أتمنى تكون محاضرة سهلة مثل ما أتوقع وما بيها تعب هواي. دائما نخلي في بالنا إنه المحاضرات اللي عادة ننطيها بالميديكال تيرمينولوجي تتضمن معلومات بسيطة جدا، ولا تكون بالضرورة بديل للمحاضرات التي سوف تعطى لكم في الاختصاصات الأخرى في السنوات القادمة. اللي نتمناه أنه خلال هذه الفترة تكون عندكم معلومات كافية عن الرينال سيستم كي تكون القراءة سهلة من ناحية قراءة الميديكال تيرمينولوجي وقراءة أي بارت من أي محاضرة تنطرح أمامكم. هذه نهاية محاضرتنا وأتمنى تكونون بخير. تحياتي واحترامي.